Health Facts, Tips, Info, Health Check Plus, Health Capsule. Sa Health Check Plus, tutukan natin ang 7 parts ng tips na hatid namin sa inyo ng 7 Sundays. Last and definitely not the least, meron ka bang self-care routine? Alam mo ba na essential ang pagkakaroon ng self-care routine para mapanatiling healthy ang sarili while working at home? Ayon sa sociologist na si Christine Carter, PhD, ang self-care ay hindi selfish. Ang self-care ay isang paraan kung saan ginagawa mong priority ang iyong sarili, lalo na kapag nagtatrabaho sa bahay. Anya, gawin din umanong panahon ang quarantine bilang isang paraan para mas mapa-improve pa ang sarili. Gumawa ng mas matibay na pundasyon sa iyong sarili at mahal sa buhay. Isa rin sa mga paraan para mas maging healthy habang nagtatrabaho at home ay ang pag-inom ng vitamin C. Lalo na't ayon sa registered dietitian na si Ryan Raman, MSRD-NZ, ang vitamin C ay nakakatulong para bumaba ang uric levels ng isang tao sa loob ng 30 araw. Kaya kung goal mo ang pagtuunan ng pansin ng iyong health while working at home, ugaliing uminom ng vitamin C at magkaroon ng self-care routine. At yan na, kumpleto na ang ating mga tips na sana'y makatulong sa inyong araw-araw na buhay. Para sa Health Check Plus, Dennis Antenor Jr. nagulat para sa DZRH, ang kauna-unahan sa Pilipinas. Health Check Plus Facts. Hatid ng Side & C at Side & C Plus. Vitamin C with zinc. Side & C at Side & C Plus. Available sa The Health E-Store, your online good vitamin and medicine depot. Affordable, convenient, hassle-free shopping. Orders delivered right at your doorstep. Follow us at The Health E-Store, www.thehealthestore.com. Email us at customercare@thehealthestore.com. Ascorbic acid, sodium ascorbate, is the generic name of Side & C. Sodium ascorbate plus zinc sulfate monohydrate is the generic name of Side & C Plus. Usapang kalusugan sa Health Check Plus. Alamin ang mga payong medikal mula sa mga totoong eksperto. Ang kaalaman ay kapangyarihan. Usapang kalusugan sa Health Check Plus.
Magandang araw Pilipinas at mga Pilipinong nakikinig sa Health Check Plus sa buong mundo dito sa DZRH Radio at nanonood sa DZRH Digital TV, Facebook, YouTube at website. Mapapanood din ang Health Check Plus sa Facebook at YouTube channels ng Health Check Plus. Kung natuloy ang panukalang maging MGCQ ang buong bansa, umpisa bukas, lalong dadami ang papasok sa opisina at sa ibang negosyo. Subalit, kahit na mag-MGCQ na at kahit na may bakuna pa, kailangan pa rin nating mag-ingat at sumunod sa health protocols dahil nandyan pa rin ang COVID-19 sa ating kapaligiran. Kaya tamang-tama ang pag-uusapan namin ng ating panauhin, keeping the workplace safe from COVID-19. Si Dr. Renato Josef ay kasalukuyang Senior Occupational Health Advisor ng Saudi Electric Company at hinirang na Outstanding Professor in the field of Public Health and Medical Profession noong 2019 ng UP Alumni Association. Siya rin ay naging Health and Wellness Consultant and Trainer for local and international agencies tulad ng WHO, DOH at ILO. At maliban sa pagiging doktor, siya rin ay isang medical technologist, nurse at teacher. Magandang araw, Dr. Noy.
Magandang araw po, Attorney Mimi. It's nice to be here with you.
Yes, Doc. Doc, bago po tayo magsimula ng ating exciting and very relevant na discussion, baka po gusto niyo po munang bumati rin sa ating mga nakikinig at nanonood.
Okay, salamat po ulit. Ako'y nagagalak na nandito po sa inyo para manilbihan para sa kaalaman ng ating mga workers. Babatiin po po. Papasalamat siyempre ako sa Health Check Plus, no? At saka sa DZRH sa pagkakataon nito. Dahil I'm sure marami pong nakikinig ngayon. Not only sa Philippines, marami pa po sa Middle East where I came from at saka sa America din yung mga yung mga fans club po roon. So nagagalak ako at tutuwa para makapag-impart tayo ng message para sa ating workers sa kahalagaan ng COVID-19, which is very popular topic nowadays for the past year.
Yes, Dr. Noy, talaga very popular yung topic na yan at nagagalak din po kami nakasama ka po at ang iyong fans club ngayong pong araw na to. So kayo po ay isang occupational health practitioner. Naging focus niyo po as a doctor yung occupational health. Marami po sa atin ang hindi nakakaalam kung anong klaseng trabaho ito. Doc Noy, ano po ba ang ginagawa ng isang occupational health practitioner?
Okay, magandang katanungan po yan bilang introduction sa occupational health, Attorney Mimi. Itong occupational health actually, part ito ng public health. So ang public health, ino-offer ito ng UP Manila, which is a popular course. Unfortunately, and I'm sad about it, kadalasan ng mga UP students, ginagawa nilang stepping stone to the College of Medicine. Pero yan, I took the road less traveled. Nag-focus talaga ako sa preventive medicine talaga, not on the clinical medicine. So ang occupational health, sa madalit sabi, sa ating vernacular na pananalita, ito po ay pag-aaral ng isang doktor sa kalusugan ng isang manggagawa. At nakafocus po kami sa prevention rather than cure. So in fact, parang nakalimutan ko na yata clinic practice ko being as a doctor sa preventive po talaga ako. Bago man magkaroon ng problema, for example, itong COVID-19, bago man magkaroon ng COVID-19, ano ba dapat ang preparation ng isang manggagawa? Katulad, isang manggagawa, pati na rin yung kanyang employer. So pag-uusapan natin, ano magagawa ng both parties na ito para magiging healthy ang isang workplace. Yan.
So Doc, ang occupational health po it has connected po talaga siya sa workplace.
Yes.
Empleyado at relasyon, yes po.
Yes, and by the way, wag na po natin kalimutan, no, ang workplace na tinutukoy natin, hindi lang po yung formal workplace. In fact, we have also informal sectors like yung mga tricycle drivers, yung mga tindero sa tindahan, ay sila po din ang workers. At again, nagagalak ako kasi ito yung pagkakataon na ma-discuss natin ano ba ang expectation or ano dapat ang gagawin din even those who belong under informal sectors para maiwasan ang COVID-19. Yan. Kasi
yes,
alam naman natin ng COVID-19, this is not just a problem of one person. This is a problem of the whole community, the whole Philippines, and the whole world. So ito yung pagkakataon na ang isang contribution ng isang tao ay napakahalaga para ma-stop natin yung pandemic. So we need everybody's cooperation.
Parang talaga pong very interesting, especially when you mention na merong yung informal sector po ng manggagawa. Minsan hindi po natin ma-imagine kung paano naka-apekto. Pero dahil na rin, Sir Doc, sa sinabi niyo sa pandemya, ano po yung naging pagbabago sa workplace? Sabi niyo either formal and informal para masiguradong safe ang mga empleyado sa COVID-19 ngayon pong panahon ng pandemic.
Napakagandang tanungan, pero bago ko sagutin po, may i-confess ko sa inyo. Tayo lang. Alam niyo ba na ako ay isang COVID survivor? Nagkasakit po ako sa Saudi Arabia and I almost died. And I felt I am the right person really to talk about it. Now, address natin ang mga pagbabago. No? So minimum muna ng requirements, I think this will be discussed a little later. Siyempre, ang minimum requirements lang is i-address po natin yung tatlong bagay dito. And I'm referring to the worker, the work, and the work environment. May it be in the formal company or in the informal sector like mga driver, yung mga titinda ng balot or anuman. Dapat yan ay address natin yung tatlong issues. The work, the worker, and the work environment. Yan. So yung basic na po yan. Okay? Basic po.
Doc, you said para sa kasiguraduhan ng safety sa workplace, kailangan i-address yung worker, the work, and the environment. Ngayon pong sa COVID-19, ano pong effect, ano pong pagbabago po na kakailanganin ng worker, ng work mismo, at saka ng work environment para po masiguradong safe po ang tatlo pong aspects nito ng workplace?
Okay. So sa worker, unahin muna natin pinaka-importante na character sa tatlo na yan, ang worker. Ang worker, siyempre siya yung may katawan, siya yung nag-aalaga ng katawan niya talaga. He or she has the responsibility to take care of his or her health. So sa pamamagitan ng promotions coming from the company, dapat maturuan natin ang worker kung paano niya pangalagaan ang katawan niya para maproteksyonan niyang sarili niya sa COVID-19. So alam naman natin na ang COVID-19 bilang bagong sakit, wala pa talagang tiyak na kung ano talaga ang kailangan dito . But basic of it all is just to maintain the body resistance of everybody. That's one. Number two, and this is very timely, now that the vaccines are coming in, Attorney Mimi, I really encourage and strongly encourage that all workers should be immunized with COVID-19 vaccine, plus their families. Okay? Let us remember, ang COVID-19 vaccine po ay hindi yan gagana until we reach the 70% of the population, which is the target for herd immunity. Ibig sabihin yan, ang virus ay hindi yan titigil hanggat hindi 70% ng population ay mabakunahan at hindi natin masolve ang pandemic. So in other words, ang worker mismo sa kampanya ng bakuna will make a very important role in here. Hindi po ang pinag-uusapan dito ay politika eh. Hindi ito nasuportahan ko ang presidente. Ay, ayaw ko sa presidente kaya ayaw ko magpabakuna. Ay, ayaw ko ng Sinovac kaya ayaw ko magpabakuna. Hindi po yun ang issue eh. Ang issue is one person could save the whole world. And let us do this with everybody kasi we have our own responsibility here. Okay. How about sa employer? Sa mga binanggit ko na dapat gawin ng employee, yung dapat ay gabayan ng employer. So dapat, what I'm saying is, the company should have its program to address the COVID-19 pandemic and specifically the one that's happening in the workplace. So therefore, it must be that the work environment should be provided with a good ventilation. That's very important. Okay? And number two, ang testing na kailangan ay dapat gawin siya sa angkop sa siyensya. At mga lahat pa ng programa ay dapat science-based tayo. Remember that this COVID-19, sabi ko nga, gawa ito ng Diyos, but there is science behind that. All the details, and thanks to our scientists, they are being studied in full details. Maniwala po tayo sa siyensya dahil ang COVID-19 ay maa-address po sa pamamagitan ng mga effective programs and services na bigay ng kumpanya through the managers and their presidents of the company.
Sa panahon po ng pandemya, ano po ang inyong suggestion tungkol po dito sa maintaining the good relationship between manggagawa at ang kanilang bossing?
Okay. Napakagandang na tanong ito. Excited ako respond dyan. We all know that communications equals relationships. Yeah, I really believe in that. Relationship could not be well maintained and established in fact kung pangit ang communication. So, anong gagawin dapat ng isang kumpanya para magpamatili ang magandang relationship with one another? Ang importante, of course, ang basic communication skills ng isang manager o ng isang supervisor is very important. More than that is address natin yung COVID-19. I would strongly recommend that the top leaders of the company, not the top leaders, even middle managers, the middle people of the company should be knowledgeable about COVID-19. Remember this, Attorney Mimi. Ano ang number 2 problem ngayon kung bakit ang mga taong ayaw magpabakuna? Because of the social media. Alright? Social media. So akin, in relation to this, dapat ang kumpanya ay mag-set up ng isang sistema. It could be a group of people or a system to address the fake news, the fake information that the employees do read from the social media. Now, you know that in the absence of communication, people speculate. Alam natin yan. Pagka wala silang natatanggap ng magandang komunikasyon, sila ay gumagawa ng mga kwento. So this is very scary at dapat i-address nito ng bawat company, bawat LGU, or dapat leaders ng kung sino man umahawak sa manggagawa. We must make sure that the fake news are aborted. Dapat mawala yan, lalo na sa in time of when the vaccines will be in. Sigurado po ako, ang dami-dami po magkaroon ng mga negative things about vaccines. So dapat ihanda natin ang sarili natin sa pamamagitan ng ganun. So I suggest, ang employers, lalo na yung mga, for example, yung mga big companies, yung mga call centers natin dyan, yung mga electronics, semiconductor, yung mga malalaki, they have to maintain a bulletin board, alright? Or Jurassic nga yan, yung through electronic means. Dapat may broadcast mail yan, meron silang probably 3 times weekly na update. Okay, remember this, the COVID-19 is a very dynamic disease. Day in and day out, may mga pambabago po sa mga researches. So dapat may isang committee, may isang body ito. Sa mga malalaki at medium scale, pwede po ang Health and Safety Committee to do the task. Alright? Meron dapat parang media relations to ensure that the right information reaches the workforce. Hindi po dapat fake news yan. Right? And so doing, mapunta po ako din dapat, anong requirement? Dapat ang manager o yung mga leaders ng company ay dapat knowledgeable sa mga basic sciences din. Hindi naman dapat doktor sila or sila, no? Dapat, for example, they must be reliant or they must be knowledgeable about the value of research. Okay? Dapat i-convince natin sa mga workers in their lay interpretation ano ang halagaan ng research na dapat magresulta siya na hindi dapat tayo naniniwala kung ano lang lumalabas na information. i-scrutinize natin dapat ang information, lalo na sa COVID-19. It's very, very sensitive issue for each one of us. Okay? So, i-promote po tayong communication, that pwede din po ito integrate sa workplace health promotion Okay? Which is another requirement. Dapat may exercise dyan, tapos makumbinsi ng mga leaders the value of health for its worker.
Doc, so maraming salamat po. Sa magandang relasyon ng manggagawa at management, kailangan ng communication at saka scientific communication para po mawala ang fake news. Yun po yung inyong sinasabi. So, Doc, para pong very informed po kayo sa relationship ng management and manggagawa. And nalaman po namin na kayo po ay nagtrabaho sa Saudi Electric Company, and your experience, you were able to gumawa po kayo ng 28 policies on workers' health with the Saudi Electric Company. I hope, Doc, you won't, kung makashare niyo po sa amin yung mga salient points po nito na pwede pong i-apply natin dito sa Pilipinas. Yung ginawa niyo pong workers' health, policies on workers' health. Yun po.
Unang-una, we will focus on the communication aspect. So isang policy actually yan. What are the details about it? How to go about it? What to do about it? So the what, the who, the whys of the policy on communication should be in place. All right? Goes with this, ensure natin dapat na naintindihan ng bawat worker ang ating ibig sabihin about the program ng COVID-19. So yan, very importante yan. I work in Saudi Electricity Company, parang napo-core equivalent sa atin dito sa Pilipinas. So dami kami mga electrician dyan, yung mga electric meter reader, so meron din mga office workers. So ang ating gagawin dyan is the basic, let us apply the basic measures like the social distancing in all things that they do, right? So that is already one policy again. The wearing of face masks, the washing of hands, and maintaining the social distancing. So lahat ng mga policies, whatever they do in the job, should have this basic requirements, no? Yung nabanggit ko. Ano pa ang kailangan natin? Siyempre, reporting of COVID-19 cases. Kailangan maintindihan ng mga employees yan on how to report it. On the side of the employer, as part of this policy again, is kailangan i-ensure natin, let us assure every employee that confidentiality, which is the right of privacy, should be observed by every company. What I do mean by this? It is, we understand that COVID-19 is a notifiable illness. Ibig sabihin, dapat nire-report ng employer ang mga cases sa company. Alright? What did I say? Just the cases, number. Hindi po natin sinasabi na dapat i-divulge ang pangalan ng empleyado. That should be a no-no. Hindi po dapat. Bakit? Because it's individual, mayroon po siyang karapatan na itago yung sakit niya na hindi alam ng mga tao sa paligid niya. But because COVID-19, just most of the infectious diseases ay could post stigma. No? What I mean by stigma, sa ating mga nakikinig ng mga informal sectors, siya ay pwedeng mabansagan sa kanyang sakit, and we don't want to happen that to its individual. Dapat maproteksyonan natin ang privacy ng tao. So this is about reporting of COVID-19 cases on the part of the employee and the part of the employer. So ano pa ang pwede natin gawin? Ang isa pang importanteng gawin as a policy which I left with Saudi Electricity Company is work health site promotion. Anong ginagawa ko? Every start of the workplace to build their resistance more so against COVID-19 is to do exercise 15 minutes every day. Okay? So big companies, they can do that. They can tune into their computer terminal, maka-built-in na yung video doon para makasunod ang mga employees before starting their computer. Ito, maganda nga ito may isang department doon na ginawa nila. Hindi makastart ang employee ng trabaho niya sa araw na yan hanggat hindi niya ma-turn on yung exercise program sa system niya. Napakaganda yung ganyan. Hindi pwede dapat unahin natin ng trabaho. Dapat unahin natin na meron tayong basic physical fitness that each of the employee could bring to their home. So ilan pa lang tayo, 6 pa lang yata o 5 pa lang policy. Napakadami pa po yan. Ang importante din is about, of course, meron tayong medical services for those who would be diagnosed to be COVID-19 employees. So anong gagawin natin? If-fit to work ba natin yan? Or isolate natin yan? To work from home ba natin siya? So these things, the employer should understand ang mga circumstances. Attorney Mimi, isa din sa policy na to support all these programs, specifically the COVID-19 program, is to is for the leader or the president or the manager of the company to surround himself or herself of experts. Kasi po it's too much for a single person to do all these things. Di ba? Anong sekreto ng organization? Ikaw ay very smart na leader kung pinapagiligiran mo yung sarili mo ng magagaling na tao on their own individual expertise. So yun po ang aking recommendation sa kanila. The COVID-19 program is not a program only of human resources. It should be a teamwork. Again, and that is another policy, encouraging that every department should give his own share or her own contribution, may it be facilities, may it be transportation, may it be communications division, may it be etc. etc. This is a teamwork. Again, the essence of COVID-19 instills upon us, sa lahat ng organization, that we work as a team because we will not solve the problem kung isa lang po tayo nagtatrabaho o dalawang. It should be the lahat ng organization. So what else? The basic mga nagawa ko pang policy. Ergonomics. Ergonomics talks about the relationship of man to his work. Okay? Paano tayo magko-computer? Sa tamang posisyon ba tayo? Ang postura natin? Tama ba yung back posture natin? Tama ba yung pag-abot natin ng mga bagay-bagay? Hindi ba nag-effect ng ating muscular system? Ano yung importansya nito sa COVID-19? Do you know that the COVID-19 attacks all the body structures and systems of the individual? So dapat lamang na we would be very, very particular about each and every system of the body. And by doing ergonomics is the program to go.
Ano po ang inyong maipapaya sa mga kumpanya para manatiling safe ang workplace hanggang nandyan pa rin ang panganib ng COVID-19?
Again, of course, nagpapasalamat ako ulit sa Health Check Plus sa DZRA sa pagkakataon na ito kasi I would say I take pride in we take pride here as a team to take this initiative to say our piece, the contribution of each and every worker, okay, sa pag-address ng pandemic. Ang sabi nga natin, nobody is safe until everyone is safe. Okay? If I may borrow the banner of WHO, and I may repeat that, no one is safe until everybody is safe. So, lahat po na gagawin natin is a team effort. No? Magtulungan po tayo sa bawat isa, and the workplace setting is the way to go. Alright? Maniwala po tayo sa akin, no? With my over 30 years of experience as occupational health professional, ay magagamit po natin ang resources ng kumpanya sa tamang pamamaraan. Alam ko po, I am cognizant of the fact na ang dami pong mga practices sa mga companies na ginagawa nila na wala namang basis sa science. So what I strongly encourage the employers is to take somebody, an expert on the field, para po hindi kayo gagastos na parang nagtatapon kayo ng pera. So my message here in this particular segment is, let us, for employers, let us make sure that we do the right thing based on science, read all the researches, delegate it to somebody who is expert on reading researches, validate the researches, the tamang findings, and then execute all the things in the company based on science. Ang COVID-19 program po ay hindi lang pagwapo o pagwapahan ito. It should be talagang with sense ang lahat natin ginagawa. Ang email address ko po ay renato.josef, alright, at yahoo.com.ph. Okay, and I would be happy to address all your concerns. Napakaligayo ko po pag nakapagpanindigan ako sa karapatan ng isang manggagawa at para din sa kalusugan ng bawat isa manggagawa sa bawat workplace. And we know that the employees are the greatest assets of any company. Without the employers, we are nothing. Alright, so saludo po tayo sa lahat ng mga manggagawa natin dahil sila po ay heroes of our nation. At for that particular matter sa buong mundo. So maraming salamat from the bottom of my heart. To God be the glory sa inyo po at sa ating lahat ang Diyos na katulong at gumagabay.
Yes, Doc Noy, opo. Doc Noy, we'll take note of your email address po and take the opportunity to message you if we need. Maraming salamat, Dr. Renato G. Josef, sa pagdalo sa Health Check Plus. Huwag kayong bibitaw sa wellness tips. Makakasama natin si Engineer Joseph Joel Ascalon, Executive Director ng C Institute. Pag-uusapan namin ang scuba diving at ang benepisyo nito at ang pag-alaga ng kapaligiran ng Verde Island Passage.